Welcome to your favorite program, Healthy Conversations. I am your host, Pastor Philip Guy, and I'm glad to welcome you once again to this episode of Healthy Conversation. In this program, we discuss health, and nothing but matters health. I believe that this is going to be very important for you, and you do not want to miss any of these sessions. Now, today, we have in studio our guest. This is none other than Danny Hong. Danny Hong, please welcome.
Thank you so much for the welcome.
Dr. Danny Hong is a well-renowned physician with many years of experience. He's a consultant physician, currently serving as the Chief of Medical Staff or Chief Medical Officer at Kendu Adventist Hospital. Now, the disease that we want to talk about today is none other than hypertension. Now, Dr. Danny, they say that the best way to know anything is basically to start by describing it. How would you describe hypertension?
So hypertension is also called high blood pressure. And hypertension is when there's pressure in the arteries are too high. So I think before we talk about the disease, we should talk about what the normal process is. Mm-hmm. So within our body, we have a heart, and the heart is the pump which circulates all of the blood that goes through our legs, from our head, and to all of the organs. Mm-hmm. And it does this through a tube or a channel of blood, which is called an artery. Mm-hmm. I like to think of it as a hose that goes to the rest of the body from a pump. So when you turn on the pump, then the water is delivered through the hose, and you can water your shamba and those things like that. Mm-hmm. But high blood pressure occurs when the pressure in that tube is too high. Mm-hmm. So when the pressure is too high, there can be problems with the tube, there can be problems with the pump, and then problem with the delivery of the water or the blood to the organs.
Now tell me, why the two different names, high blood pressure, hypertension? Is it just that it can alternatively be used, or there's a special meaning to that?
So high blood pressure is the same thing as hypertension, but hypertension is the scientific or the official medical term that we use for the diagnosis of the disease. Mm-hmm. So when someone says they have high pressure, it's synonymous with hypertension.
Okay. Now tell me, what is it that causes this pressure that pumps the blood in the arteries? In other words, what causes this hypertension?
So the body needs pressure because we need the blood to be able to go through all the different parts in our body. Mm-hmm. So, the pressure cannot be too low, because if it's too low, I would not be very effective at watering my plants or watering my organs. Mm-hmm. But it needs to be at an appropriate level where if it's too high, it can also damage. Mm-hmm. Imagine if you're watering your garden and the pressure was coming out very, very strong, then your plants would be damaged, isn't it? Mm-hmm. So it needs to be at an appropriate level where it's not too low and not too high.
Mm-hmm. So what's the appropriate level? I believe that there are certain parameters that doctors use to check and measure that this is an appropriate level of pressure and this is what is not appropriate. What would you call an appropriate level of blood pressure?
So what we typically use as the cutoff number for normal is 120 over 80. And this is measured in millimeters of mercury, which is a unit for pressure. Mm-hmm. Yes, and so that top number called 120 is the systolic pressure. Mm-hmm. Anyone above that is called to have an elevated blood pressure. Mm-hmm. And the bottom number is called the diastolic, and anyone above the 80 is to have an elevated diastolic blood pressure.
Now, does this systolic and diastolic, does it differ between adults and children, or it's basically the same rate? Sometimes I hear that when people grow older, there is a different level of pressure, and different from when they are younger. Is there any difference with that?
So for children, generally, we don't expect them to have abnormal hearts, and we don't expect them to have abnormal arteries. So in general, children, we assume to be healthy, and they don't have high blood pressure unless they have some underlying anatomical problem with their heart or their blood vessels. So typically, we diagnose high blood pressure in adults. And as people get older, their walls or their arteries, or the tube rather, gets stiffer and stiffer, and it becomes less compliant. So when the pressure goes out, it's less adaptable and flexible. So then the pressure does increase as they get older.
Okay. Now you talked of the diastolic and systolic. I've heard some people say that, it is the lower one that is more critical. Is there any difference between the diastolic and the systolic in terms of which one is the more critical parameter to check on in terms of checking on someone's pressure?
So they're both equally important because they look at different aspects. So somebody may have an elevated diastolic pressure, somebody may have an isolated elevated systolic pressure, but in either case, if either or both numbers are elevated, then they have high blood pressure. So it's important to treat the blood pressure regardless if it's the bottom number or the top number. We should still treat it.
Okay, now tell me, how do I know that I have high blood pressure? Is it something that I can know while I'm walking, while I'm going about my daily duties, I am eating, or maybe I'm at my place of work, seated in my office? How do I know that I have high blood pressure?
It's difficult to know because most people with high blood pressure actually don't have any symptoms at all. They may be walking around, working, studying, doing their daily activities without any complaints, without any feelings of sickness or illness. That's why we call it a silent killer or silent disease. So the only way that you can know if you have this is if we screen and we check to monitor the blood pressure. And that's usually done through a blood pressure cuff. It's a cuff where they put around the arm, and then it inflates so that it can check your pressure of the artery that's going through there. That's the only way that we can monitor, that we can continue to evaluate, to see, and also diagnose people.
So without this cuff being put on your hand, there's absolutely no other way? Or does it mean that maybe later on in life it's possible for someone to know that I have this symptom, I have that symptom, and they can tell me that I probably would have high blood pressure?
The symptoms are not very specific. Like you may get some headache, you may feel tired, you may have some blurry vision, but those things are not very specific to this disease. You know, for example, the headache could be from a stress, it could be from a malaria, it could be from many different causes. So it's difficult for people to know exactly which symptoms correlate with the disease unless we check them. But the good thing is that checking is relatively easy, relatively painless. In fact, it shouldn't have any pain at all. And it's accessible. So you can we should be able to go to any healthcare facility, any dispensary or hospital to get that checkup in a matter of minutes.
Now, when it comes to checking high blood pressure, is there a certain arm that is supposed to be used, or I can use any, whether it's the right hand or the left hand? Is there a certain position I need to sit or stand to be checked? Are there things that I need to know so that I'm sure that this checking is done correctly and it's going to produce the best results to help me know of my condition, or it doesn't matter?
Yes, there are techniques to properly take a blood pressure. For the patient, they should technically be sitting for at least 5 minutes so that they're calm. Somebody who's running in for an appointment, if they're running late on time, and we check it right away, it may be falsely elevated. And then you want to sit them with their feet flat on the floor, uncrossed with their legs. They're in a calm manner. And then either one of the arms are okay. There's no problem with either one. And then typically we advise them not to take any stimulants like caffeine or any other medications that may elevate or raise their blood pressure. And that should be the most reliable. But having one test of a blood pressure, even if it's elevated, may not give us the whole picture. So what we typically do is we bring them back and we check it again. Because once we establish that their pressure is elevated, we want to see if it's consistently elevated or if it's an isolated one-time event.
Is there any such a thing as a false test or false result when checking high blood pressure?
So there can be a false positive or false negative, and that usually correlates with the size of the cuff, of the blood pressure machine that's being used. For somebody with a very small arm, and if we're using a cuff that's too large, it may falsely give the impression that the numbers are lower. And if we have somebody with a larger arm, but the cuff that we're using is too small, then it may falsely elevate the blood pressure.
So then that means there are different cuffs for different sizes of people, and you know, the one that would fit different kinds of arms.
Yes, one size is not fitting all.
What about the medical personnel doing these tests? Is it possible that there would be some personnel who are not knowledgeable about doing this test and they would end up giving wrong results? Do I need to go to a highly qualified person, maybe someone with a high level of education, to be able to get my pressure correctly tested?
I think in the past, when there was decreased and not as much awareness and sensitization, even among health workers, we were not being able to diagnose our patients and catching it early. But there have been a lot of changes and a lot of push by various NGOs, the Ministry of Health, the different facilities, that now they're more keen on checking those numbers. As soon as you go to the hospital, they should be getting those. And we call them vital signs. Vital because they are vital and important. So as soon as they step through the door, we should immediately put them on the blood pressure machine, check their temperature.
But you said after they rest for 5 minutes.
Yes. Immediately after 5 to 10 minutes.
Okay.
Yes. And
So
then we check those
that's
numbers.
when we check the vital signs.
Yes.
Thank you so much. Thank you, Dr. Hong. Now, I'll take you back a little bit. I'm still curious on what exactly causes this pressure to pile up and push too much in the arteries. What exactly is the cause of this disease? Remember earlier on we had talked about these lifestyle diseases, and you had mentioned some things about the conditions in which we live, eat. How is this related to high blood pressure?
That's a very good question. And there's a lot of different factors involved. So there are factors what we call that are modifiable factors and non-modifiable. So things that we can change versus things that we cannot change that improve or degrade our health. So non-modifiable factors are things like your age. Those, no matter how much we want to change our age, unfortunately, it's something that we cannot change. Things such as our gender, things such as our ethnicity, those things we cannot change. However, things we can change are our behaviors. I can choose whether to smoke, I can choose whether to drink, I can choose whether to remain active and get some activity and physical exercise. I can choose what types of food to put in my body. Those things all affect the blood pressure, and also the amount of salt that I intake can also affect blood pressure.
Wait a minute. What about the non-modifiable factors? Do they also affect the blood pressure in any way?
Yes. So as people get older and older, their pressure does get a little bit higher and higher over time when the vessels are more stiff.
And there's nothing we can do about that?
So there is things that you can do, because by exercising and by also taking a good habit, healthy habit, you can delay some things, and also when you can age well. For example, in somebody who doesn't eat well, who doesn't exercise, their aging process may be much more accelerated compared with somebody who had a healthy lifestyle.
What about family history? Is high blood pressure in any way related to hereditary issues? I would come from a family where all the other 8 or 6 members of my family have high blood pressure. I don't have it. Does it mean that I'm predisposed and I'm likely to acquire high blood pressure because my family has it, or maybe my grandfather had it, my father had it? Does that give me a chance of likelihood of having high blood pressure?
So for almost all diseases, there's a genetic component. So we talk about this in the scientific literature where it says it's nature versus nurture. So it's how you were brought up and also how you were born. So there's certain things that when we're born with, like such as the way that we look, our appearance, and some things, our disposition, those things are handed down from generation to generation. Those things we cannot change. However, the environment that we grew up in, we can also sometimes overcome those genetic issues. For example, yes, high blood pressure is a genetic condition that can be passed down, and it does have a genetic component, but that doesn't mean that we can be defeated by our genes, because we can still work really hard so that we can stop the disease and we can prevent it from going on to our future children or our future grandchildren.
Dear viewer, you're watching Hope Channel, and the program is Healthy Conversations. Today we have Dr. Danny Hong, a consultant physician, bringing us to speed on matters health and particularly hypertension. So please just sit back, stay tuned, and let's get facts that help us to know how to live our lives as we live in this world which is full of diseases. So today we're discussing hypertension. So Dr. Hong, tell us, there is high blood pressure. Is there any such thing as low blood pressure?
Yes, there can be low blood pressure.
And what does that mean?
So low blood pressure could be a normal body's response. For example, if you are a small person, a slim young female, you may have a low blood pressure, which is your normal resting blood pressure. However, people who are experiencing symptoms of low blood pressure, which is from a disease, for example, if their pressure was known to be elevated before, and if it's dropping low, then we say that they're sick. Yeah, so there are people who have a normal blood pressure which is lower than average, and then there are people who have a high blood pressure but then it's dropped lower, and that's from a disease.
How dangerous or how fatal would it be to have low blood pressure? Or is there any difference between the fatality rate of high blood pressure and low blood pressure, or it just doesn't matter?
So high blood pressure is a chronic disease, chronic meaning it's a cumulative and long-term illness. So it's not going to affect you on a day-to-day basis, but we look at the consequences of having high blood pressure over a long period of time. We measure it in even decades, around 10 years or so. But having a low blood pressure can be very fatal even at one instance, because if you're not able to supply the oxygen or the blood to your brain, not able to supply the oxygen to your heart, then you can collapse.
But there's not one of them which is worse than the other.
So somebody with very, very low blood pressure, for example, let's say if they're bleeding or if they've overdosed on some drugs that makes the pressure low, that can be more dangerous. But overall, we're talking about chronic illness, which is high blood pressure sustained over a long period of time. Yeah, typically that's the much more common scenario where we have people with high blood pressure. Low blood pressure is rarely seen.
So, Doctor, I know you've seen many patients out there in the US and in Kenya and in several other countries where you've worked in. What are people's perceptions about high blood pressure, or even misconceptions about this high blood pressure? Let's demystify it for the viewer to get clarity on these matters.
So I think the number one misconception people have is that if I'm feeling well, I don't need to treat something. So a lot of the times, like I've said, hypertension or high blood pressure is undiagnosed because people may not seek medical attention if they're feeling fine. But it's important to know that our body can accommodate high blood pressure and we adapt to our illness up to a certain point. So we can accommodate and all of a sudden now we have a stroke, we have heart failure, we have problems that we're swelling in the legs, we have kidney disease. So it's important to recognize this early because it is treatable and it is even reversible so that we don't progress and we develop complications.
So are you saying that if I am feeling well, then I still need to go for a health check or something like that, because it's not normal for me to feel well and just decide to go to treat what now? What do I treat and I'm feeling well?
So what we're treating is we're maintaining our health. So health, it's like saying, my car is running fine. Why do I need to bring it for servicing? The wheels are still spinning, isn't it? But we bring it so that our car can maintain its function, so that it can continue to serve us for many, many, many years.
So you're saying with this, I need to go to the hospital from time to time to ensure that my health is optimum and none of these diseases would would catch up with me, like hypertension.
Yes, for younger people in their 30s, 40s, they can even go as infrequent as once a year or twice a year. But we do recommend checkups because in addition to checking blood pressure, they should also be checking to make sure they don't have diabetes and those other common non-communicable diseases.
You know, some of these things, when I know health is really wealth, but sometimes when we look at things in terms of going to check your blood pressure, one thing that runs across, many people of low income is it's expensive. Will I afford it? How expensive is it to check just my blood pressure on a regular basis as a 30-year-old, 40-year-old? How expensive would that be on my pocket?
So the cost of checking the blood pressure on the facility would be the cost of the batteries. So typically they're using some small portable machines and they insert a couple of AA batteries and they check that. So there's very, very little cost associated with that.
So the cost in itself would not be a deterrent to someone getting to a hospital facility and checking their blood pressure?
No. And the chances are that you and I probably know people with high blood pressure, and they may even have a machine at home. Now, with technology being compact, we have small machines that people can just purchase at home, and we can have neighbors using it. We can screen our friends. We can screen the village. This is something that we can do in an effort in the community.
That can even be done for free.
Yes. Yes.
Sure.
Yeah.
Thank you so much. Now, back to the misconceptions. I don't know whether this is a misconception or not. Some people associate high blood pressure with a certain amount of body weight. Does it mean that if someone doesn't have like an excess body mass weight, they would still be able to have high blood pressure, like those who are not really, I don't know whether to use this word, skinny or thin, can they still have high blood pressure?
So yes, high blood pressure is at a higher risk when you have obesity or when the people are big. And the reason why is because when people are big, we're assuming that their also cholesterol is higher. They have higher fats inside the blood. So that also really directly impacts the arteries because the arteries should be clean for the blood to go through freely and openly. But if they're having deposits of fat and deposits of cholesterol, and also their arteries are being made stiff by their body habitus, like their large bodies, then it's difficult and for the blood to go through smoothly. So yes, bigger people do have a higher risk for high blood pressure, but it's not only a disease of big people.
So even smaller people are able, it's possible for smaller people to also have high blood pressure.
Yes, but the prevalence is much lower. For example, for smoking, even though we know smokers have higher rates of lung cancer, not all patients with lung cancer are smokers.
That's true.
Yes.
That's true. Now tell me about this thought that high blood pressure is only associated with the affluent, with the rich, with the high and influential people. Is that true, or is it possible for people who are in the middle income or in the low income group to also have high blood pressure? What do you take on that?
So I think there's a variety of different factors. You know, the socioeconomic factor is a strong one because people who are more affluent, who are higher, they may have less physical activity, and they also may be eating more refined products with a lot of animal meats, fats, and things like that that increase their risk of high blood pressure. But now that we're seeing, even among the local people, that there's more accessibility in the road, so that they're also walking less, they're also eating more refined foods. So I would say that this disease has now spread across different socioeconomic lines now. It's a disease that does not respect just the wealthy and the affluent, but also even the poor.
It cuts across.
Yes.
Now, tell me, without pushing you too much into the actual statistics, what would be the general range of people with the hypertension, and what are the level of, risk factors in terms of percentages or numbers, if you have any off the cuff?
So in 2018, the numbers that we studied at that time was 1 out of every 3 people was suspected to have.
That was way back in 2018.
Yes. And even then, we think that that number was severely underestimated because a lot of people were not being screened. So we can only have a true accurate number if we're screening everybody so we can see how common this is. So you can imagine people who have never been to a doctor or have never been to a nurse to screen, they may be people that are yet undiagnosed. So that number we can expect to be even higher. And they have been projecting to see what the estimated burden of this disease will be, and it's estimated that 1 out of every 2 people may have this in the next decade.
1 out of every 2 people in the next decade.
If we are checking everybody and if people are still not changing their lifestyle and continuing on this cascade of illness.
Doc, those are scaring numbers. And
Yes.
you mentioned earlier that this is a silent killer. People would just be walking with it and they don't know that they have it. That's dangerous. So I think it then means that we need to do something about it. Do you think like creating awareness, talking about it is going to help bring people to check their levels and know their pressure levels and maybe change their lifestyles? What do you think could be the best thing to do so that we don't have these numbers rising high, but instead bring them down to manageable levels?
Yes. So one thing is raising awareness by screening everybody, sensitizing people on the need for screening. Another is raising awareness of the consequences. Many times these chronic illnesses, once they have already had a fatal incidence where you have a stroke, where you have a high blood pressure that's causing heart failure, or the kidney patients who are also on dialysis, it's already very, very late. Some of those things cannot be reversed. So I think it's important to highlight that these diseases, if left untreated, will lead to those poor outcomes and those consequences. So it's important for us to treat them early.
Thank you. Yeah, let me bring you back again. You have mentioned it again that hypertension is a chronic disease. What do you mean by chronic disease? Just break that down for me.
Sure. So So when we talk about disease, it's something that's very acute, which means it's happening really quickly and it's lasting short period, or something that's been with us for a while. I'll give you some examples. For example, when somebody has, let's say, an acute flu, then we expect it to go away within a week
within
or so.
a short time.
Yes. Or somebody, let's say, they were playing football and they sprained their ankle. We expect that to go away after a few days or a few weeks at the most. But with chronic illness, it's something really that's there for long, and we must be on top of it and maintain it and really be keen on managing it over a long period of time. It's not something that we can just treat with a drug and stop treating and it will go away. With things like infectious diseases, like a diarrhea, a malaria, those things are very acute and it's a one-time thing. But with things like diabetes and especially high blood pressure, because it's cumulative and chronic, it's something that we must maintain awareness even over a long period of time.
So what does this mean towards the socio-economic aspects of this person as an individual or as a family, or even of the country or the nation as a whole, or the world, global world as it were, in terms of socio-economic aspects of these chronic diseases?
So earlier you mentioned that health is wealth. Well, the opposite is also true. Being sick is expensive. So I think, one way of saving costs is by making sure that we're maintaining our health, because the only way that for poor people who cannot afford care to keep them out of the hospitals, making sure that they're maintaining their health. So by making sure that we're living a good lifestyle so that they don't develop high blood pressure or reversing that, they would really help save that money. So the burden is not just about the health for the country, but also the economic. The country spends billions and billions each year for screening, for testing, and pharmaceutical drugs. Pharmaceutical companies are creating drugs each year, different ones, new ones, combination ones, all designed to treat
this. A lot
of
money goes into research in these pharmaceutical companies.
Yes, lots and lots of money and efforts have gone into that.
And this is something that we could save on if we would take care of our health and do the right thing.
Yes.
Thank you so much. I know we'll be going back in our next episode and we'll be talking about what we need to do in terms of hypertension, in terms of cure, in terms of remedies. But just back on the causes again, what would be the most important thing that the viewer needs to know about the cause of hypertension, that which they would really want to avoid?
So there are so many different causes, and I think it's not just one thing that's causing that. But I'm going to give you a list of the top most common causes that we have. So as we already mentioned, obesity is a leading cause of high blood pressure.
Yes.
Yes. And our eating habits. So eating foods that are rich in fats, rich in oils, and also that are refined, those are probably also second most common cause. And then in other countries around the world, smoking is a leading cause of high blood pressure.
Okay.
Yeah, so those things are the top three issues that we have.
So those are top three things: obesity, eating habits, and smoking.
Yes.
These are things that we need to watch in order to avoid hypertension, so that we take care of our health, because as we said earlier, health is wealth.
Yes.
Thank you so much, Dr. Danny Hong, for bringing us to speed on matters hypertension. This is Healthy Conversations. I am your host, Pastor Philip Guy. I'm looking forward to the next episode when we'll be discussing more and more on hypertension and many other diseases in the subsequent episodes. Thank you so much for watching. May God bless you. Stay tuned on Hope Channel.